And so I'm really looking forward to hearing from one of our next guests, Gaurica Chacko from FTI, which, by the way, FTI is powering the next Hit Lab Salon coming up in next week. And we'd love to hear from you. If you'd like to join that, please contact the folks at Hit Lab about that. But very excited to to welcome both Gaurica as well as a guest, Jamie from Scarlet Health, one of the leading labs in the country, who's now using this virtual first model to help to deliver labs and lab resources to the home and to the business in ways that, again, only BioReference could really imagine and reimagine and reinvent. So, Gaurica, thank you for joining us, and looking forward to hearing the interview.
Thanks, Dan. Hello, everyone. So quick introduction, Gaurica Chacko, Managing Director at FTI Consulting. And I lead our digital diagnostics, R&D and commercial practice. Really looking forward to our conversation here. With me is Jamie Kaliebe. And I was thinking, Jamie, if you could just start with a quick intro about yourself and your role, and then we can jump into our questions.
Yeah, absolutely. Thank you so much, Gaurica. Thanks everybody for having me here. Really excited to be a part of this esteemed panel and program today. My name is Jamie Kaliebe. I am the Vice President of Scarlet Health Delivery here at BioReference Laboratories. Scarlet Health is the newest addition to the digital transformation and digital program here at BioReference. And we are reimagining what diagnostics look like with our digital health program. And Scarlet Health is an extension of that. As the Vice President of Delivery, my focus is on delivering the best, most seamless product to our patients to empower them to take control of their health, and also to providers and digital health companies, telemedicine companies across the country, as we become more and more dependent as a nation on digital health and telemedicine.
Great, thank you. So can you talk a little bit more and probably just give us a few examples on how digital health technology is truly reimagining testing and diagnostics?
Absolutely. So it's such an interesting time, right? So in 2020, because of COVID, the need for testing surged. And so did investment in telemedicine. As we all know, I mean, I think it doubled to 1.6 billion or something of that nature. So an enormous investment in telemedicine happened, and it was accelerated because of COVID. And that really reflected that growing demand, that there was an appetite for telemedicine already. And we were able to kind of leap forward many, many years and get to where we are today. So it's funny about diagnostics because before COVID, it wasn't even a thought in people's minds. Of course, right? I don't think, I mean, even people in the industry, maybe they thought a little bit more about it. But I don't know about you, Gaurica, but I don't think until COVID, most people thought about PCR testing, let's say. Most people probably didn't even know what PCR testing was. So now it's become just this household subject that everybody's relatively familiar with, and they've taken control of their health by, you know, requesting COVID testing, getting COVID testing. I think we've all had a COVID test in the last year and a half, but a lot of people probably don't remember when their last blood draw was. So I think now with the launch of Scarlet Health, I'll speak specifically about that and how that's changing because it's a reflection of the change in this industry. I think now, you know, the launch in January of this year of Scarlet Health was really the crystallization of all of the work and all of that progress towards telemedicine and towards a more, excuse me, a more virtual experience for our patients. So Scarlet Health helps bridge the gap between telemedicine and in-person medicine. So of course, if you have a telemedicine encounter, you're still probably going to have something in person. There's going to be some sort of follow-up. So whether that's a blood draw or radiology, imaging, anything like that, I mean, you're not bringing a CAT scan machine into a patient's home. So us being able to bring a blood draw into the patient's home makes a huge difference.
Yeah, I agree. So in 2020, I was with Quest Diagnostics. And so I saw exactly what you're talking about, you know, testing became front and center, and the direct to consumer was a huge play. I mean, so I joke that my mom talks about PCR, right? Like,
Yeah, exactly.
A general term. So, talk to me about opportunities that you see now, fast forward to 2021 and beyond, in the digital health space, to bridge the gaps in care.
Yeah, absolutely. So I think in thinking about the opportunities, we have to think about what the gaps are right now, correct? So I think the biggest issue is that millions of people are without access to adequate healthcare, whether that's no access or not enough access to quality care, because quality is what makes the difference, right? And there are a couple of reasons for that. It could be a regional barrier. They might be in a very rural area. It could be a financial barrier where they don't have insurance, they're uninsured or they're underinsured. It could be a social barrier. There are a lot of people who mistrust the healthcare system for very good reason. There are also people who are not health literate and don't engage with the system because of that. There's lack of quality care for many of those reasons above. And then I think as we think about digital, how digital health is transforming the industry, we have to be realistic about it and admit that there is a huge gap, that technology is the gap. So technological literacy is a huge gap. There are people who might be left in the dust as we convert to a totally digital world and a digital healthcare model, because they're not comfortable with technology. They might not even have access to a high-speed internet, right? They might not have the devices that will connect them to high-speed internet. We saw that with COVID, where there were school children who couldn't do virtual learning because they didn't have Wi-Fi or they didn't have a laptop. So we have to admit, as an industry, as we think about all of these revolutions that we're taking, that there are going to be people who are left behind, and we have to try to focus on that and be inclusive of them. But that's where the opportunities come in, right? Being able to expand nationally. So Scarlet Health is a mobile phlebotomy service. It's powered by an on-demand, on-location, fully integrated digital platform. And for us to be able to reach the most rural area, or even, at the major metropolitan area, that's incredibly important. We want to make sure we're being transparent with pricing, and that, this is a service that's covered by insurance, because that makes a huge difference in patients' lives. We have to recognize that distrust in healthcare and try to educate patients and include them and engage them, and empower them to feel like they're part of the conversation instead of being talked down to. And we have to provide quality care regardless of everything that we just spoke about.
Oh, I couldn't agree more. I mean, it kind of goes into our next question, but the example that you gave about access, right? So like broadband access, not everybody has broadband access, right? So, when you talk about the greatest challenges to care that you are witnessing right now, with a focus on testing and diagnostics, what would you name as the three biggest or the greatest challenges to care?
That's a great question, and there are many, but I the top three, first and foremost in my mind, is patient testing compliance. Second is payment and insurance coverage, which we kind of spoke about already. And the third is health literacy, which we touched on. From the perspective of patient testing compliance, so again, COVID has put laboratory on the front page. It's your mom is talking about it, my mom's talking about it. Everybody is very familiar with a COVID PCR testing and happens to be an expert at this point. Yes. But generally speaking, there is very little compliance when it comes to laboratory testing. So we actually know that 70% of all medical decisions are made based off of laboratory diagnostics and the findings that they get. But there's still 30% of patients who do not actually get their blood drawn when their healthcare provider gives them a lab script. So 30% of those tests going undone makes a huge impact, right, on the patient's health and population health. So if you don't catch disease early, it's going to cost the system more. It's going to lead to worse outcomes. It really changes the course of a patient's life. And if we can make laboratory diagnostics more approachable, make it more comfortable, come to you in your home, in your space, and have you be empowered by this and be able to be the one who's in control of it, you're much more likely to engage with that, to get your labs drawn, and to ultimately make a huge difference in your health down the line.
Yeah, I couldn't agree more. Early detection equals early intervention.
Yep.
In some cases, prevention, right? So, so let's end on a positive note. Where do you see the future of lab testing in the next 5 to 10 years? You know, where do you see this going?
Yeah, I truly think, and it's not just because I'm part of Scarlet, I truly think that at home mobile phlebotomy is that's where we're going, and especially when it's powered by a digital platform. So giving patients a superior customer experience, having expert phlebotomists who come into their home. I'll give a very, very quick anecdote because I think it's important, because the future, a lot of people feel that the future of testing is in the home, but it's through patients collecting their own specimens via a kit. I think a lot of us are pretty familiar with the very popular kits that are everywhere these days, where you do a COVID swab yourself, you can stick your finger, and those are amazing. Do not get me wrong. They're really important to expanding access, but I consider myself pretty well-versed in this stuff. I consider myself pretty health literate. And I did one of those kits myself. I read the instructions, and that goes back to, you know, the health literacy side of things, and engaging with healthcare. But I read the instructions. I thought I had it all figured out. I took the lancet out. I pricked my finger. And the moment the blood started coming out, I felt faint. All the instructions went blood was everywhere except in the microtainer. So needless to say, I did not get a quality result. I didn't get any results from that. And that just kind of shows you that we can be healthcare consumers, but we should still involve the experts, right? So having an actual phlebotomist who is, this is what they do, will really put you at ease and help you want to engage more with your own health instead of you having to do it all on your own. So that's how, sorry guys, that's how I feel, you know, that's where I think that we're going in our industry. And that's where I truly think that we should go.
Yeah, the concierge service.
Yeah, exactly. And you know what, it's concierge service without concierge price, right? The person with the worst insurance in the most rural area should be able to have that concierge service, the same as the executive who lives on Park Ave.
Yeah, thank you. This was great. I know we're at the top of the hour. I really enjoyed our session. Back to you, Stan.
That's a fantastic interview. Thanks you so much, Gaurica, for that great interview. And thank you, Jamie, for joining us today. I know how busy you both are, and can't thank you enough for taking some time out to really give people an idea of what the future of healthcare is looking like here in the United States, but also what it's going to be looking like for all 8 million people with mobile lab services. The goal for all 8 billion people globally someday. Now, who knows if the diffusion of technology will be in 5 years, 10 years, 20 years, 50 years, or in the case of smallpox eradication, 200 years. But the idea is to have the conversations now, start getting the discussions going now, and start, really trying to find the solution sooner than later.